Thank you for watching the video of an overview of our research study about the relationship between pediatric food insecurity and the COVID-19 pandemic. This project was created by Craig Cox, Sarah Kramer, Aaron Long, Carly Shirey, and Christy Turner. Aaron actually wasn't able to be with us today because we're trying to coordinate 5 schedules and work schedules and family schedules across 3 different time zones, but she definitely wanted to be here. And this represents all of our work over the course of the last 8 weeks for MPH 6006. To introduce this project, I wanted to say that this presentation actually provides an overview of several different research questions and studies. And so it's really more of a tour of everything that we learned. And because we learned about different types of studies and research designs and methods, we weren't able to fit that appropriately into one. But every study does have some things in common. So they each center around the relationship between pediatric food insecurity and COVID-19. And the disease or illness of interest is actually malnutrition and all the associated illnesses and symptoms. So it's not COVID-19. In fact, the pandemic is sort of the time period and the economic backdrop and conditions for our actual disease of interest, which again is malnutrition. For every study mentioned in this presentation, the population is children ages 0 to 19, and the setting is DuPage County, Illinois. So children ages 0 to 19 in DuPage County, Illinois. For our problem statement, we know that many children ages 0 to 19 experience economic and physical outcomes of the COVID-19 pandemic. We also know that food insecurity causes adverse health outcomes in children, and that people in counties other than DuPage County are experiencing exacerbated food insecurity during the pandemic, which we'll talk about a little bit in our literature review. We do know that nutritional deficiencies intensify the symptoms of COVID-19. So if there's increased risk, there could be increased severity as well. And there's variability in the success of efforts to combat food insecurity since March 2020, when this all started. So we do know that this is probably a problem, and we do know that if that's the case, it's severe, but we don't yet know the scope of the problem or really have enough information to develop an intervention or respond to it. Our literature review findings revealed to us that food insecurity puts children at risk for adverse health outcomes. And actually, as food insecurity increases, adverse health outcomes increase. So those things are positively correlated. We know food insecurity causes vitamin D deficiencies, which increase the symptom severity of COVID-19. So again, it's likely that they would have an even more severe case, which makes this very important. Families receiving SNAP benefits in Nevada experience exacerbated food insecurity. So we can reasonably think if it happened in Nevada, it might happen elsewhere, including in DuPage County. Federal funding for food insecurity increased during the pandemic, suggesting that it is a problem, but with varied success in 5 studied cities. So suggesting that we haven't totally solved the problem. Some strategies to combat pediatric food insecurity actually create opportunities for viral community spread. So we talked about this in our group. Things like schools distributing lunches and food pantries can spread COVID. Families with a low socioeconomic status shoulder amplified burden of the pandemic. And of course, low SES people face increased risk of food insecurity before the COVID-19 outbreak. And so that was what our literature review pointed to, that there's a lot of context for these problems and research to suggest that they are taking place and that they are severe, but not a whole lot of specific information about the exact conditions in our area and population of interest. So Carly is going to go through and introduce one possible way to get more information using quantitative research methods.
The proposed quantitative research question states, is there a relationship between pediatric food insecurity and the COVID-19 pandemic in American children? As stated earlier, the disease of interest for the study is malnutrition. The chosen study design is a retrospective cohort study that will allow us to further investigate the research question by looking back in time. The population of interest that we have chosen is people that are aged between 0 and 19 years old and who live in DuPage County, Illinois. The alternative hypothesis states that there is a relationship between pediatric food insecurity and the COVID-19 pandemic in American children. However, our null hypothesis states that there is no relationship between pediatric food insecurity and the COVID-19 pandemic in American children. The chosen quantitative analysis method is a Pearson correlation analysis. This analysis will be conducted to test the strength of association between pediatric food insecurity and the COVID-19 pandemic among American children.
Now, Christy and Craig are going to walk us through another option for a research study to answer a separate but related research question using qualitative methods.
So as Sarah said, in addition to using quantitative methods, we would also explore qualitative options. In this proposed study, the research question would be, how do children understand the relationship between pediatric food insecurity and the COVID-19 pandemic in American children? So what has their experience been with this, COVID-19 phenomenon? For our sample and recruitment, we would be conducting a purposive sample. It would be directed towards children who are ages 0 to 19 who live in DuPage County, Illinois. We selected 13 participants for the qualitative study. The recruitment methods would be to partner with DuPage County schools, and we would screen enrolled students for food insecurity. And in that process of recruitment, we would also obtain signed parental or guardian consent form for all of the students who are younger than age 18. So for our qualitative data collection methods, we would use first questionnaires that would evaluate participants' level of food insecurity relative to school closures and get qualitative feedback about that. We would also be conducting interviews in schools with the children, either on an individual basis or using focus groups to get that data. And then lastly, we would use participant observation where the researcher would be, somewhat involved, but, more of an observer. They would be in the cafeteria with the children. They would be observing during snack breaks to make qualitative notes about, who maybe has less food or more food, and, what cultural norms are present, what social norms are present during those periods of time. And then for our analysis method, we would also develop a code book where at least 2 analysts would code for themes to generate a theory. And we would also, validate that with the inter-rater reliability. Sorry, totally had a step there. And so that's how we would analyze this qualitative data. So for our sample interview questions, we would say, tell us about your family. We would ask about habits, cultural traditions, hobbies. We would ask the children, what are some of your favorite meals your family made a year ago? And then maybe compare that to more recent things. What are some favorite meals your family makes this month? So that we could identify any differences in what's changed for these children. And similarly, we would ask, what was your favorite school lunch last year? And what's your favorite school lunch this year? To see what changes have come about within the school system. And we would also ask, do you have enough food at home? And do you have enough food at school? And describe how you know. And we would gain more qualitative data from these open-ended questions.
Okay, for our sample interview guide, first we would acquire permission from the schools to conduct interviews and obtain parental consent for the participants. We would greet the participant at the beginning of the interview and explain the purpose of the interview. Next, we will describe how the information will be documented and gain permission to audio-video record the session. Allow comfortable, appropriate accommodations for participants so communication is easily achieved. And then begin with a subject that is not sensitive, but is important to the respondent in order to build rapport and trust. This will allow for a pleasant atmosphere to generate open communication. Begin asking interview questions. Avoid asking leading questions. Avoid judgment or opinions so the participant remains open to answering questions. And finally, thank the participant at the end and allow them to ask questions about the interview process.
So those are two main outlines of possible studies. And now Craig is going to bring us home and talk about our IRB application to make sure that our process and our way of including people is all above board.
So the type of IRB application we chose was the expedited review. And the criteria for this decision was based off of the use of surveys, individual interviews, focus groups, and oral histories.
There are various quantitative study instruments that will be used within the study. For example, blood tests will be used to measure nutrient levels, and if available, a review of previous lab results from prior checkups can be included. Physical examinations to assess for below average BMI, as well as a review of height and weight records from pediatrician records if we are able to obtain those. And a survey, questionnaire, or researcher interview can be used to analyze food security prior to the pandemic versus during quarantine and lockdown periods.
Our qualitative study instruments will include questionnaires and surveys. It will include interviews, individual and focus groups, and it will also include participant as observer, where the investigator identifies as the researcher while interacting with the participants in the social process.
Okay, so for safeguards and assurances, the researchers will complete a course in human subjects research, such as the Collaborative Institutional Training Initiative. Consent forms will be stored in a safe manner for several years. They will be separate from any accumulated data from the participants, and everything will be in locked filing cabinets, or the use of password encryptions will be used. ID codes will be used for each participant to increase confidentiality. So we replace the names with codes as early in the process as possible. We'll secure permission from school leadership and school district admins. In focus groups or individual interviews, the participants will be allowed to use pseudonyms, and consent will be obtained from parents and children 18 years old and older, as well as assent from children less than 18 years after receiving and understanding all the research-related information.
Thank you for watching this grand overview of our possible research studies that we learned about in class. Of course, we want to give a nod to our references that we use mostly for the literature review and the study, but also for some bits and pieces along the way. I think I can speak for the group when I say, as people who have been consuming public health research for so long, it was really kind of interesting to put ourselves in the shoes of people who are producing it. And I think back to week 2 when we had so much trouble kind of thinking like, oh no, we're the ones doing it, right? So we're not just citing a study that's giving us the answers, right? We're doing it, and kind of our grand tour now in week 8, I think we've really just leaned into the people, to being the people who make the decisions. This was a really fun way to apply some things that we've learned in other classes too. Like we've talked a lot about our biostatistics class and the epidemiology class that we all took, and overall a good opportunity to sort of apply the things that we've learned and figure out from start to finish, how can we do this in our jobs and just in our roles as good citizens for public health. So thank you for watching, and let any of the 5 of us know if you have questions.